Women who've had the BRCA gene, so women like Angelina Jolie, what can we do for them? You know, they're at higher genetic risk for breast cancer, but if they've had their ovaries out early, surgically, all of a sudden, what does that make them? Premature surgical menopause with health risk of heart disease and bone loss and dementia and, you know, painful sex and Parkinson's disease. So there's observational data that shows no increased risk if those women are given estrogen, so no increased risk of breast cancer, and it balances out those health risks. So we're recommending that women have an individual discussion about pros and cons, and then options if they do choose to use hormone therapy, how to minimize any risk from taking it. In 2002, it just kind of fell apart because everybody was so afraid of hormone therapy. But what's happened is we've now come back full circle to know who it's safe for. And we've also learned a few other lessons, like we now know that there's some unique risk for compounded hormone therapy. And when women stopped using government-approved therapy because of that study, they went to the compounded products because they were told they were safer and just as effective, or might even prevent breast cancer. And so now we've done studies, you know, that show that there's risks of overdosing, underdosing, sterility issues, contaminated issues. And so I do have a plea, you know, that prescribers use government approved unless there's an allergy. You know, we have bioidentical government approved therapies that are safe, effective, monitored, regulated. There's a boxed warning for vaginal estrogen, and this has been a members issue that came up at NAMS, that our patients were not using what we were prescribing to treat vaginal atrophy, painful sex, or even urinary tract infections because of the boxed warning. So we have a citizens petition, and anybody can write in and support that petition asking the FDA to change the boxed warning. Just remove the box, leave the warnings there, but to say if you have bleeding, you need to have it evaluated, endometrial biopsy or ultrasound. If you've had an estrogen-sensitive cancer, you need to have your oncologist be a part of this discussion because there's no evidence that these low-dose vaginal estrogens cause breast cancer, heart disease, dementia, stroke, or blood clots. So the citizens petition is alive. The docket at the FDA closes on November the 14th, and then we'll hopefully get some type of response. You know, right now, the warnings on every estrogen product are the same. Well, I just told you that conjugated equine estrogen decreased the risk of breast cancer. They have it in there, here's your risk, but then the boxed warning says increases the risk of breast cancer. The new therapy that I told you about, conjugated estrogen and a SERM, showed a reduction in breast cancer cases, and in the boxed warning, it tells you that it increases the risk of breast cancer. So women get really confused. I thought you told me that this was neutral on my breast, but here it says it increases the risk. Or a husband says, why would we use a vaginal product so we could have sex if it's going to give you probable dementia? So we have a lot of work to do. You know, the FDA has to be, you know, protective of women. They have to tell us all the risks. But we're also harming women because they're hearing about risks that aren't actually there. There's a Beers criteria that you shouldn't use estrogen after the age of 65. So women are being denied getting their hormone therapy. Now, we would never recommend initiating hormone therapy in older women, but some women have persistent hot flushes or bone loss, and we can lower the dose, minimize the dose, you know, give them intermittent progestin. We have ways of trying to make it safer for those women. And so we've written a practice pearl that can be downloaded from menopause.org, and we also have in the position statement, we're going to address that specifically. That if people need educational information, menopause.org is a great source. And also, if women want to find a credentialed practitioner, there's a webpage that they can go, they put their zip code, and it shows people who've been credentialed in their area, which means that they've taken an exam that says they know about menopause, which means they're open to discussions, have like all of this information. I know that we have over 1,000 credentialed menopause practitioners. Some of them are physicians, some of them are nurse practitioners or PAs. Some of them are OBGYNs, family medicine, endocrinologists, because it's really, women's health is multidisciplinary, and that's what makes our organization so unique. We have a dermatologist who just joined us. One of our board members who's going off was an anthropologist. One of our past presidents was a nurse practitioner. We really want to look at women's health in total.